Taoiseach, we in Ireland, along with much of Europe, imported the idea of lockdowns from China. But in China, they also built hospitals in 14 days in response to COVID-19. The HSE's capacity census last year showed that ICU capacity in Ireland increased from 255 to 280 in the 9 months from April to December. At the end of last year, Minister Donnelly announced that we were going to increase capacity to 446, 321 by the end of this year. However, to date this year, we have increased capacity by only 9 beds. Taoiseach, I'd like you to explain what we are doing about increasing hospital capacity. Your Taoiseach announced earlier this week, our hospitals are under pressure. I don't remember a time when they weren't. ICUs operate generally to capacity, and you'd rarely have a time like now when 40 ICUs are free. Yet, we're being frightened again that our ICUs are going to come under pressure and that we're going to have to endure more restrictions and potentially more lockdowns. But what are we doing about increasing capacity? Taoiseach, I appreciate that you can't develop ICU beds overnight and it takes time. But we're not talking about 14 days like China. We're now more than 14 months into this and progress is slow. On Monday last, there were 278 people on trolleys in hospitals in Ireland, 63 of them in Limerick. This Monday, there were 293 people on trolleys across this country, 60 of them in Limerick. Now, we know that that sort of overcrowding is a recipe for disaster in the event that there is another wave of COVID. And if we look to other countries, like Israel, for example, where the success of the vaccine rollout was lauded, there has been another wave, and there will be more and more waves. But all I hear is that we're putting all our eggs in the vaccination basket, and we're doing apparently very little to develop our healthcare capacity. Now, I'm not saying that we shouldn't do both, but Taoiseach, what is your government doing to increase healthcare capacity? Because you know, we have grandiose promises from Minister Donnelly, and there are 3 former Ministers for Health in that cabinet, including yourself, who have delivered plenty of grandiose promises, but no additional capacity. I'd like an update on capacity and what will actually be done about it, as opposed to what will be promised.
So the 600 million winter initiative, that has made a significant difference to the capacity of the health service. And without it, we would have been in real trouble over the Christmas period. And I'm glad we took the initiative early last autumn to sanction that. Because if it hadn't been for that level of investment in home care packages, community diagnostics and acute capacity, we would have been in far, far greater difficulty during the winter period. So 236 million in revenue and 40 million in capital expenditures was provided as part of the winter plan and budget 2021 to fund general acute beds on a permanent basis in our acute hospitals. This funding has provided an additional 834 general acute beds to the system over the number available on the 1st of January 2020. And then we need more information from the 6th of May, but because of the ransomware attack, that's not readily available. 73 subacute beds in addition to that had been provided under the winter plan. Funding of 52 million was provided in budget 2021 to allow for 66 permanent critical care beds to be put in place to bring permanent baseline capacity to 321 by the end of 2021. Baseline capacity at the beginning of 2020 was 255. The HSE has advised that 41 of those 66 beds are now staffed and open on a permanent basis, bringing the national total to 296. But we want to get to 321. Of course, it should be noted that the number of beds open on any particular day can fluctuate due to a variety of factors, including the use of surge capacity. The HSE also has the capacity in the private sector in terms of the agreements it has with the private hospital sector in terms of any additional needs that will emerge. So there has been actually real tangible gains on capacity increases.
Deputy McNamara.
Thank you, Taoiseach. I've no doubt that money is being spent, Taoiseach. Your government is throwing money around like it's confetti. Our borrowings are entirely unsustainable. But it's not having an impact. You said 296 critical care beds. Dr. Colm Henry last week, the Chief Clinical Officer of the HSE, said 289. Either way, it's a long way short of the number promised by your Health Minister, Stephen Donnelly. In addition, we provide 6% of our budget to mental health. I suggested mental health was suffering as a result of both COVID and the restrictions. I was pilloried for it, but it seems, unfortunately, that it is suffering. Yet our funding to that remains low. But above all, the barometer is the number of people on trolleys. And the number of people on trolleys is still at an all-time high. So whatever you're doing and whatever money you're spending, Taoiseach, it is not having the impact that we need, because there are 60 people on trolleys in Limerick last Monday. That's not good enough. And it's not good enough at any time, especially in a pandemic, when we know that there will be more and more waves to endure. And we cannot restrict and lock down indefinitely.
Taoiseach.
First of all, I think we need to give credit to the health system as well, because I think it stood up very strongly to a very difficult wave from the January into winter period. And I think the investment in the Winter Initiative Plan was key to enabling us to have a better flow through hospitals even before the wave came. So November, December were better months than previous years, and this was prior to the wave, for flow through hospitals. And I think the home care packages were key to that. The 5 million extra home care hours provided, which had a very significant impact in terms of flow through acute hospitals. The overall health service plan provided for about 16,000 additional recruits. That's the biggest challenge, actually, getting a sufficiency of staff quickly in all areas that was indicated. And so the recruitment of staff remains a big challenge. And the HSE put forward that it could recruit 16,000. Now, to be fair, it is moving in that direction, but over time they'll get there. But that is a constraint in terms of getting staff to the levels that have actually been provided for in terms of additional staff.
We've seen really significant investment in health, billions, but yet that equates with, what, an extra 9 beds? It doesn't make sense to me, Paul.
I think what they're going to be judged on is that big figure. Initially it was 2 billion for COVID, 2 billion additional. That's going to be maintained. I think what the government will be judged on is whether people tangibly see a difference, or do we still have trolley numbers in the hundreds? Do we still have hospital ICU beds not being delivered?